it's great to be back in the best group of this whole thing. I mean, I just I'm not biased at all, but I think this is the number one group.
Well, I'm glad we got to stay in such a great group then.
I'll have to ask for apology. I have to apologize. I have a call with my father's physician at 11 that I have to take. It should only take 10 minutes. I do apologize, but I need to speak with him.
Gary, you never have to apologize for taking care of your family.
Hope everything's okay.
Yeah. And if there's any homework, we'll assign it to you while you're gone.
as it should be.
Like any good team, right?
All right, well, I think we all know each other since, as we mentioned, this is the same group as last time. Just a quick reminder, I'm here again just as a neutral facilitator, just to kind of help us move along and take notes while we're talking. And as Amy mentioned, we have really two main goals for today. The first is to review the updated version of the principles and see if there's any last minute changes or additions before we finalize them, hopefully as a group today. And then also to spend some time just thinking about if there are some strategies that we want to discuss for kind of moving these principles into action during this legislative session or further in the future. And then also if you all have any thoughts or suggestions on just kind of how we can keep moving this work forward as a group, even as these official council meetings come to an end today. So with that, I will share my screen in just a moment so that we all can look at those principles. But first thing is first is that I need someone who is going to agree to report out for us when we rejoin as a group.
I nominate our wonderful reporter, Gene.
He did a great job last time. So.
Okay.
That's what happens when you do a good job, Gene.
Reflecting the good work of the group.
You made us sound really good.
Sorry, guys. This is Joyce Kravick. I keep getting booted out. I've got a problem with the internet.
Oh, no problem. Glad you're able to join us. All right, well, I will go ahead and just share my screen then. If I can find the right document. All right, let me make it bigger so we can actually see it. Okay, so I think the first thing that we should do is really just looking at oops, sorry. Is reviewing these principles and just seeing if there's any kind of last minute additions or changes that we want to make. At the top here, we just included some kind of general summarizing of what this council is, when we've met, what we've talked about, who's on the council, and then also what the purpose of these principles are, which is really to guide the legislators, the governor, and also the public as we consider different options to increase coverage during this legislative session and going into the future. Is there any feedback on those sections? We can get into the actual principles. Okay. All right. So into the principles, the first one remained mostly the same, except as Amy mentioned, we kind of added in the affordability piece into this maximizing health coverage piece. And I know that's something that this group especially talked a lot about was, whatever approaches we consider, even if there are multiple approaches combined together, that the end goal should really be that we're covering as many people as possible. Any feedback or edits for this first principle?
I'm not making a suggestion so much as I want to toss something out for discussion. So when I think about all the things that we've talked about, and we've looked at how many people, all these different things, if you look at the second bullet under maximize healthcare coverage, multiple solutions may be required to achieve this goal. I still believe in that kind of menu approach, if that's what it takes. But as we talked about this and we looked at the numbers, and to me, it seemed that by doing carve outs like, where is it? Limited expansion for any group. But we talked about pregnant women, substance abuse disorder, parents of foster children. There was no data. It seems to me it was very clear that those are cost prohibitive to do. You get few people covered for a lot of money. And that doesn't seem to fit with the first bullet under there that talks about affordable coverage for as many people as possible. And so I just wondered, I mean, I'm not saying we should take it out so much, but maybe say, well, I don't know. In a perfect world, I would just have it say multiple solutions may be required to achieve this goal, period. Because we've looked at some things that are not, in my opinion, financially sustainable. And they don't make sense on paper either, when you do the math. And so knowing that there'll probably be some difference of opinion about that, I'm still willing to put it out there to talk about.
What I hear you, what you're saying is sort of the investment that we have to make. And for the investment that we're making, part of it should be coverage as many people as we can for that investment. Is that part of what I'm hearing?
Yes, Jean, I just think that it sounds so good. Yes, you captured it. And it sounds so good. It sounds so reasonable, actually, to say, if we did a little of this and a little of that and a little of this, I mean, we certainly could do that. But at the end of the day, the state is going to spend more money to do that than some other things. And so I just wonder if we want to include that in our principles. When we know that it's not really feasible financially.
No.
I like what Representative Adcock, I think that's right, because I wonder because let association health plans and the kinds of populations we're thinking about coverage under these limited Medicaid carve out coverage, I think can be different populations, right? So then you can do both together, right? Do both together and maximize with that same investment, right? To your point. And so there is a way to do some of those things like reinsurance or tax credits for employers and Medicaid expansion. And right, but to your point, there are different levels of investment that are needed. So I wonder, these principles are meant to, and I'm sorry, I'm forgetting the ones that if you scroll down, Elaine, right, there is one on efficient use of taxpayer dollars, right? So to get to Representative Adcock's, and I wonder if that needs to be moved up and maybe paired together. And I wonder if that, to capture that together, because we know that this is our reality, is cost is there's only so much we can do. Yay, if we had forever resources, of course we would want to cover everyone, but that's not reality.
Actually, I'm so glad you brought that up, Mandy, because that was going to be my next suggestion, is that really maximal coverage in the most fiscally sound way, in a simple way. Those three things to me are the most, well, and comprehensive, are those who are kind of the big four to me. And so moving, even though I know these aren't numbered and they're not listed in priority order per se, I do think there's a perception when I read them of what rises to the top versus falls closer to the bottom. And I'm not calling anybody out, but I love Joyce Krovic, and I'm just going to ask her what she thinks about this conversation.
Thank you, Gail. I love you back. I like all of the ideas, and Secretary Cohen is exactly right. We have to use the taxpayer dollars efficiently. So we'll have to look at all of the things that will work and won't work. But I don't really want to throw any of them out. As Secretary Cohen said, they're different populations, so one doesn't necessarily affect the other. I know I've been wedded to the association health plans, and now that's not looking so good as an option. But I don't really want to take any of those out. I still want us to look at every opportunity that we can use. Some of them we may not be able to do, and we may eliminate them very quickly, but I don't think we should say that we're not going to explore those.
I'm going to agree with you because of this. If we don't, as I think about this more, if we don't list them, people say, what about? What about?
Right.
And this way, it's very clear what about. And I'd also say to you, Joyce, it was very sobering to see the grid for the association health plans and realize that by grouping together and becoming a large employer, it's more expensive for you. That was a sobering bit of information, wasn't it?
Yes.
That was not my concept of it.
Right.
Very helpful.
The other thing I'm hearing in your comments, Representative Adcock, is the idea, and I'm not sure, is this idea of adverse selection. Be careful for that, because sometimes the pool gets, and I'm not sure what the folks that would be carved out, whether that would skew us one way or the other. So it's that traditional sort of insurance concept. We just got to be mindful of that.
Well, that's another disadvantage for the association health plans, unfortunately, because if you're become a large employer, then your own claims history plays against you.
Exactly.
Whereas if you're a small employer, you're using community rating. And so that's to an advantage. I mean, it's so counterintuitive,
Yeah.
but it was clearly on there. And so, yes, I agree with you about the adverse selection thing we have to keep in mind.
Sorry, on mute. So I think we landed on keeping these options listed in here. Okay, great. And I moved up the efficient use of taxpayer dollars, but it sounds like it potentially even could be folded into this first principle, or at least having it moved up shows that it's a priority.
Joyce, do you think it's better to mix those together or have that pulled out separately? The efficient use of taxpayer dollars, sitting where you sit over there in the Senate. How does that sound to you?
I like where it's been moved,
Okay, great.
so that we realize that, we have to consider that with every option. And Elaine, I am so impressed with your skills on this screen.
And you and Joyce, you also think it makes sense for it to be its own separate bullet rather than try to combine it.
Yes.
That's what I was thinking too. I was curious what you thought.
Yeah, I think it might be helpful that way. It draws even more attention to it rather than having it get lost. All right, well, let's move on. The next two are new ones that were added after the last conversation. The first one, I remember we discussed some, which was that, even if we're using multiple options, trying to make sure that they're implemented in a way so that consumers and providers don't have added layers of administrative burden and confusion. So just that's kind of the program simplicity one. And then the next one was that, whatever options we're thinking about, just remembering that the end goal is really to further the health of North Carolinians. Any feedback on those? All right. Well, the next one is health system sustainability, which is really that, whatever options are selected should be fiscally sustainable for the full healthcare system, which includes consumers, providers, hospitals, safety net organizations, and the state.
Hey, Jean, should that say hospitals, or what? Is that still the right terminology to use these days?
Yeah, that's a good point. Maybe just, I think because it has healthcare systems. So I think that would be, good, but thanks. That's a good call out. The thing that comes to mind in terms of health system sustainability is also this idea of, and maybe it's a different place, maybe it may, but I want to talk about the rural care piece of it. It's just to support access in rural care and vulnerable inner cities. And because there's one thing to have overall sustainability, but we have pockets where there's greater concerns. And there's something I want to lift out here, and I don't know how to put it when I was looking at it. We don't really have, and we talked about it last time, we don't have, and I've got 35 people working on just this concept, and is this idea of what is a sustainable rural model. We talk about it a lot, but we haven't necessarily landed the plane on that. So I don't know where that fits. So clearly we've got to have sustainability of the infrastructure that supports health, but there's a piece of that that's specific. We talk about disparities, which is good, but I don't know that we call out rural care strongly enough, unless I missed it somewhere else.
So we have our next one is strengthening our rural
I'm sorry,
communities.
right, it's right there.
But we certainly should look at this and see if you think this adequately covers.
Yeah, I guess is to, sorry, so it is there. I think my sense of it is that, I don't know how to articulate it, but when we're strengthening, we'd be more specific about defining, because in rural care, there's a lot of things. Are people, it brings in telehealth, it brings in people working at the top of their license, it brings in incentives, it brings in different care models. So it should include, I guess it'd be inclusive of best practice models in rural care.
And I don't know if this is the place to put that, Jean, but I think back to the many times I've heard Secretary Cohen talk about, those wraparound services that we often don't think about it when we live in a place like Cary, where I live, but the transportation, the food desert, all those things that actually probably are a problem in a lot of places, but very much concentrated and exacerbated in rural areas, and confound our ability to deliver care to rural communities. Well, because if you have every intention of getting to your appointment with your healthcare provider, but you have no way to get there, right? Because it's 60 miles away, you don't own a car, there's no public transportation. Maybe that's beyond the scope of this, but you're on to you're really on to something there. And can I go back to healthcare system sustainability, health system, and ask you, because you're our atrium guy there, if you're satisfied with the way this is worded, do you think there's anything that can be done there to make that either stronger or more easier understood, or do you think the way it's written is okay?
That's a good question. Coverage option that consider for North Carolina, I should invest in that. I would probably add the long-term fiscal sustainability of healthcare systems, because I think we have to have a long-term view on this, and sometimes we're looking at making sure 10 years from now the structures that we put in place continue to strengthen that. So that's probably the word that I would add.
Okay, I think that's really important, because sometimes we know that there's a spike in utilization when you give people care that they've never had before. You expect them to take it, right? But so you're going to see a spike, but then you're going to see it go down, and you're going to see a more sustainable kind of utilization. And so I think that captures much of that, because the utilization, of course, is directly tied to fiscal sustainability.
Yep, that's exactly right. The only other thing, and I don't know how to put it in this, but part of the challenge that on the sort of the acute care side of the health systems have is what comes to mind right now is behavioral health. You come into our acute settings, you come into our physician offices, and there's nowhere to go. So it is this network of ambulatory support services that are important. We're going to be dealing with this with Medicaid too, as we reduce inpatient utilization. The question is, where in the outpatient setting can care be received? And we really don't have a great network, certainly not around behavioral health, but in other areas about that. So we have behavioral health in here, but it's a broader concept in healthcare sustainability, because what's happening, we talked about children and different things, and people that we're retaining for lack of a nursing home bed or for lack of behavioral health. So I think the wraparound concept is around community-based networks for sort of step-down care. That I think is really
I know we're jumping around a little bit, and I feel for those of you who are trying to keep up with this, but I think in that bullet about behavioral health services, it seems to me there should be something in there about improved access to community
Yes.
mental health and substance abuse disorder treatment. We deinstitutionalized mental health. Heck, I was in nursing school when we did it, okay? When Reagan did it. And we've consistently, that's trickled down through the states and our state. And I think that's our biggest gap. Not everybody needs institutionalization, but sometimes that's all you can get if you can get that.
Exactly.
That was going to be my question. Does North Carolina have adequate residential and institutional level of care for those who do need that level?
No.
No.
Okay. So I think
because it's a losing, and I sit on the SHIC, that comes up with the state medical facilities plan every year. And there aren't people asking for to build a lot of behavioral health beds because it's a very expensive, while necessary, it's a very expensive proposition. And so many people, while they need short-term treatment, what they really need is long-term
long-term community support. That's right.
That's right. That's right.
Early intervention is becoming one of our foundational elements of a behavioral health system. And our system is, how do we build early intervention into primary care visits, emergency room visits, so that we address the top of the funnel and not just try to solve for the narrowing scope at the bottom.
And
right.
Elaine, I don't want to include residential and institutional in here. And in fact, we're under court order to decrease our footprint on that side. So let's not, that would be not good for us.
All right.
Well, good for
Got
you.
it.
Well, it's good for you to give us that feedback because, of course, I didn't know that.
Yeah. Yeah. That's anyway, court order before I even got here, long-term work to try to
You don't want these documents to be subpoenaable.
Yep.
But I do think we've strengthened that bullet. I think by adding what we've added, we have made that more
I like it.
what we truly mean.
Great.
We realize that we're waiting for the patient to walk into the ER in acute crisis is what we want to avoid. And sometimes that begins by routinely screening them for depression and anxiety as part of their primary care visits, right?
Great.
So the one other thing I was going to bring up, Elaine, and it's in the bullet, but I wonder if we should bring it into the title, is on the supporting the business community. The words there really speak to small business, which I think is right, and which is what we are, think what we are talking about here when we talk about business tax credits. It's not all, it's small business tax credits. Association health plans is for those smaller businesses to sort of band together. So I just wanted to make that edit here. Otherwise, I think we wind up getting so potentially distracted, because healthcare is expensive for everyone. And so I don't want to take, I know that, but okay, you got it already.
Let me add this.
Right.
So Gary Salamito had to step off the call to handle something family business, and he's here representing the chamber. And of course, Andy Ellen's in another group for retail. And what I would say, having worked for a large business, is that while I think the problem is most acute for small business, it is still a big problem for any business, because the more you spend on healthcare, the less you have for R&D, the less you have for infrastructure, the less you have to acquire and retain talent. I think when he comes back into the group, I'd really like to get his feedback on that bullet. Not that I think he will disagree. He just may have something additive that captures the help we want to give all business. Am I right? Am I off base on this, guys?
I think I would agree. It seems like it's disproportionately sometimes impacts small business, but it has a generalized effect if we're not smart about it. There's another concept also, just in looking at the distribution of PPE dollars and things of that nature. There's been an unequitable sort of distribution of those dollars around Black-owned businesses versus non, and I think there's an equity component here that I think maybe it'll be important to capture as well.
And I would also add that we need everybody pulling this same oar to help get us there. And so we need all of business to say, what a great idea, right? And that's my other thought.
Very good point, Representative Adcock, that you're making just there. So I might take back my amendment of saying put small there, but I think we should then change the language to recognize that it's larger, because I'm thinking of Tunde talking about the fact that if we expand Medicaid, that he knows there's going to be a premium benefit for the large group, his large group market, not just small business market.
Right. Now, Mandy, I agree with you. I think it should come out of the bullet heading, but be somehow folded into the descriptor, because I do think exactly where you're going on that.
Right. So even if coverage doesn't change, there's an affordability that could change for large businesses in terms of their insurance with Medicaid expansion in particular.
This is Don Flo, and I would confirm that and say, I think you're absolutely correct. It's really two different things. It's access for small businesses. Of course, there's a cost association, but the bigger issue for larger businesses, the sustainability of it as relates to cost, and how to be able to manage the cost structure with that in the long term.
Thank you so much. I think that just puts the cherry on top.
That's good. I like that.
All right. One we skipped over was reducing disparities. That, solution should increase healthcare coverage, should prioritize reducing disparities, both by geography, race, and ethnicity. Is there anything to add there? I know, Jean, I definitely take your point that it should be called out again in the business community bullet.
Or sometimes when we laundry list, I don't mean just here, just anywhere in life, we inadvertently leave something out important. And I just wonder if perhaps not trying to laundry list might help here. Prioritize reducing disparities of all kinds, or something like that, or including but not limited to, or something that doesn't say these are the only things to consider.
Yeah.
Because, it's not, your disparities are not just race and ethnicity, geography. It's your sexual orientation and gender identity that often makes you have health disparities, because you are discriminated against in the healthcare system, and therefore you don't seek healthcare. I mean, I worry a little bit about the laundry listing. Anybody got some suggestions?
I would probably, I think it would be good to add gender and sexual orientation.
So I'm not the best spokesperson for the LGBTQ community.
Jean, I think you're in.
Sorry.
I think they'd say gender identity.
Yeah.
And sexual orientation.
Yeah.
And
Sorry.
that's okay.
My comment was, in this particular way, I do think it's important to list it out to the gender, sexual orientation, because sometimes if reducing disparities becomes about everything, then it becomes about nothing. And so we really need to have a much more tailored approach on geography, which to me means as much, I think, both rural and urban poor, because those are typically concentrated in, and maybe by geography, we might need to name that as both rural and urban poor areas, or however we want to say that, gender identity, sexual orientation. But I think we have to be specific, because again, sometimes when we say reduce disparities, it's so broad that it's unfocused, and it really doesn't, is not oriented towards impact.
I agree with you. You're absolutely right. My fear was we'd leave something out, but that's not a bit, the bigger fear of making it so amorphous. Everybody goes, what the heck does that mean? Right?
And then the last one is, again, a bit of a laundry list. And this was kind of just the other considerations that we've had for increasing access, whereas most of the previous principles have focused on coverage. So we included cost of care, telehealth infrastructure, network adequacy, workforce development, access to primary care, social determinants of health, and preventive services.
I don't have any trouble with that. Anybody else?
Nope, that's good for me.
Okay, well,
Wait a minute, I'm looking over at
Yeah.
my colleague in the Senate and I'm asking her, what have we missed, Joyce?
It looks like everything in the world is covered.
Wait a minute, that's not code for this is terrible, right?
I don't think we missed anything in there.
So you feeling pretty like this is pretty comprehensive.
It's very comprehensive. Yeah, I think we've covered, certainly covered everything that we've discussed and then some. So,
Is there anything in here that, that, you know, if I was to take this to my caucus and explain it to them, they're the things that I feel like they would probably ask me questions about. If you were going to take this to your, I'm not trying to put you on the spot. I'm just trying to make this.
right.
Is there anything, if you were to take this to your caucus and say, hey, look, guys, look what I've been helping with. What do you think that you think you'd get pushback on or questions about, or say, gosh, that doesn't seem clear? I mean, is that a fair question, Joyce, or not good?
Yeah, I think there would be a lot of discussion. They would want to, you know, more details on everything.
Okay.
What it's going to do to the cost and what it's going to do to the system as a whole. But there would be a lot of discussion.
Well, that's good, actually, because that's what we
Which
want,
we
right?
want.
And the good
Yeah.
news, I think we've got a lot of cost and benefit figures. So that's good. And if we need more, we know who to get them from, don't we?
Right.
exactly. I was just about to say, you know, without overstepping my bounds, you know, if there are questions like that come up, we're more than happy to help with providing information. And as Representative Adcock just mentioned, a lot of it has been presented already. So it could be, you know, sharing slides and things like that.
And I also think, I don't know about everybody else, I'm such a visual person that when I see something, you know, I like to read, and when I read, I got decent reading comprehension. But when you put it in a grid side by side, it just smacks you right in the face and goes, oh my gosh, you get the aha moment. And as much of that as we can do, if we don't do anything, this is what we got. If we do this step, this is what we've got. If y'all have done a lot of that, that would help someone like me and Carla, who are, you know, here in the House, and it would help Mike and Joyce over there in the Senate say, take a look at this, right? And because we're going to be the ones people are going to ask questions of, and we're glad to do that. But we need an easy way to explain it.
I think that's such an important point as we go through from these principles is it's an accept, because we all in these meetings, we've had 4 meetings, and then somebody will ask, and then we'll have to remember or pull from slides. I think to package this in a really good way that takes all of the key points that were aha moments throughout this process, that were, some of them were counterintuitive, and also some of which that needs to be backed up with specific numbers, costs, you know, and so the way that how we package this, and then those of us in this group can communicate that in our respective forms, I think is going to be the art part of the science exercise that we went through. So I do think it's going to be, I would echo that the communication vehicle from here is going to be really important.
That's really helpful.
Elaine, that's my question for you is going forward, is that coming next after the breakout sessions, I think, and I'm really excited about having the conversation about how we move this initiative forward in all spaces, in the business community, in the legislature, you know, across the board. So I do think I would Representative Adcock that charts and graphs, simple charts and graphs, not complicated ones, make a huge difference when they are put up on that board. And I think Senator Krovic would likely agree. I don't want to speak for her, but when they splash up on that big white screen, it makes a huge difference in understanding in the room. So I think that's an important point.
Yeah, that's great. So we can spend the last couple of minutes talking about next steps.
Hang on one second, if you don't mind.
Sure.
Gary's back with us, and I would love for him to have the opportunity to go back up at least to the business bullet and have him a moment to read that and see if he thinks that's from his space says what it needs to say.
Yeah, Gary would love any thoughts on this bullet, supporting the business community.
And then, of course, your input on everything, Gary, but that one in particular.
Of course.
I mean, that one in particular, you know, you're our content expert here, and I forget what other small businesses we might have on the line.
Well, thank you for that. And again, my apologies for not being able to be fully engaged during this section. If I, yeah, I think it says it the way it should. Thank you. And
Right.
the only thing perhaps, and this is not necessarily need to be added, is to have the larger businesses kind of be available for counsel to smaller businesses as they look at benefits, as they look to how to negotiate and manage costs that are not, within the insurance plan that they're buying, but there's a lot of synergies there, and there's a lot of interdependency on a business relationship. And can we begin to have that exchange of information go along healthcare lines too? And that's too many words, but y'all are pretty good at capturing in a few words what I'm trying to, that synergy and that interdependency is probably something we need to take better advantage of.
And Gary, do you think that actually has to go in that bullet, or could it go here under additional considerations for access, or does it sounds like a policy thing, really. It's like, here's a way for for large businesses to partner with small businesses in such a way that they share their experience and expertise and make it easier for small business to succeed as we begin to expand coverage. What do you think about that?
Yeah, I think wherever it makes sense from from an order standpoint and from a flow standpoint, I'm good with it. Just one example is what like for the Biltmore large organization out west, what they've done with their vendors and how they brought their vendors in and talked about how they help their employees, and under the appropriate circumstances, can they help their vendors' employees too, because they're important ecosystem there. So, and their vendors are smaller businesses of all sizes across all different disciplines. So wherever it makes sense. Thank you for the opportunity to provide a couple of remarks.
Of
I
course,
think
yeah.
maybe that goes under those future steps thing.
That's what I was just thinking too. Yeah.
Because we don't want to lose that. That's an excellent point. And I've heard the Biltmore folks describe their system many times, Gary, and you're right on the money about they don't just look at their own employees. They really take a broad view, a meta view of everybody that they work with.
And I just want to make sure though, because Elaine, I don't feel like we fully captured Don Flo's comment or the conversation earlier that we were talking about, is like, there are some policy solutions that are going to make coverage more accessible, particularly for small businesses. That's a lot of what if you go back to the earlier list when we talked about maximizing coverage, I think that's where we're going to see some. But I think the other piece of this was the fact that when you see just expanded coverage across the board, it lowers rates for people in the large group market. And Tunde sort of articulated that, and I'm not seeing that captured yet in this bullet, both the ability for solutions to increase coverage just by total numbers, but also by doing that, creating policy solutions that also make overall insurance more affordable for all businesses. And I'm sort of just looking to capture Don's point there. And again, you can wordsmith, but I want to make sure we capture.
I think
Gary,
the last part of your
coverage increase. Well, yeah. Don, did I get it right?
It did. And Gary, you might follow this with the idea that there's two really issues going on. For small businesses, it begins with even having access and creating the framework for it. For larger businesses, the continually increase of healthcare cost and what that does to erode their margins and their sustainability. So they both have interests related in this, but they are slightly different.
And I think you're fixing it. I think the last part of what Mandy said was what you're trying to capture, which is the increasing the policy solutions that make coverage more affordable for all businesses, particularly large business. That's so this,
and this goes, I think, to Representative Adcock's earlier statement. I would recommend we think about some visuals that would show the relationship of access to coverage to cost. So we can begin to see how that fits, and think about kind of this on graphs that would show two different poles. One would be cost, high, low, access, high, low. Where's the sweet spot where we're trying to get? well, what drives that into that sweet spot for us as a state?
Oh, I love that idea.
Great. It looks like we're going to get kicked out of our small group in about a minute. So we'll have more time to talk about kind of next steps when we return to the main group. But I think the biggest thing I heard from you all as far as next steps is summarizing the conversations and the presentations that we've had in this council in a way that's really clear and concise, and that you all can take to your caucuses and to your other stakeholders to kind of explain what we've done in this council. So that will definitely be on our to-do list. And Jean, do you want me to share my screen when we walk through this as a main group, or do you want to use your notes?
I think I can still read my notes, so I'll try my notes and maybe supplement if I miss anything, team.
Sounds good.
Okay.
All right. Well, I will see you all in the main room. Thank you so much for your
Group
That is
one.
great discussion. Thank you.
thanks, everyone.
Thank you.
Thanks, everyone.